Several key questions are being asked about the mutants or the variations of the COVID virus which are now circulating around India. So let's try and explain what exactly it was. It was called the SARS-CoV-2 virus. That, of course, was first detected in Wuhan in China. But as in the case of all resilient viruses, there is a process of changes or variations or mutations being formed, and that is very much the case over here as well. Now, of course, the SARS-CoV-2 virus spread all over the world, but let's talk a little bit now about this. The UK variant, it's called B.1.1.7. It was first detected in Kent in the United Kingdom. Let's talk about the India prevalence, because this actually started spreading a great deal across India. Now, these are just the top 5 states: Delhi, Punjab, Telangana, Maharashtra and Gujarat. And there were lots of samples which were collected, and these were put through gene sequencing. 1,877 samples collected by the 4th of May. But the belief is, and this is what the government actually has to say, is that the spread of that UK strain is actually going down a great deal. Instead, what we are seeing is what is being referred to as a double mutation. In other words, what's called B.1.617. Now, why is it called a double mutation? Because other than other variations, which as we mentioned is normal, it's got 2 specific ones which actually enhance its transmissibility of moving into human beings. This has been detected first in India, in Maharashtra. Let's talk about the India prevalence, in other words, the top 5 states: Delhi, Gujarat, Karnataka, Punjab and Telangana. So, as in the case of the UK strain, it's actually broadly the top 5 states are more or less the same. So, that has made it actually difficult to tell what the difference in the medical issues are. What are some of the symptoms which people of the UK strain have, which people of the India strain don't have, for example? That's unclear because they come in the same geographic area. And the total number of samples which have been collected are not enough yet to determine that. But here's what we know in terms of medical conditions of what the original SARS-CoV-2 virus was: transmissibility. Now, in the past, in say a family of 10, 2 to 3 people would actually get infected. Now, in both of these mutant strains, transmissibility is much more. So, in a family of 10, 8 to perhaps even all 10 would get infected. If you look at the old strain, detection would come 3 to 5 days after contracting the virus. In the new strains, it could come as early as a day after contracting the virus or 2 days. Let's look at recovery. The old strain used to take more time for recovery, between 10 and 14 days in many cases. The new strains, you are seeing a large number of cases where people recover faster, between 8 to 10 days. Now, what about age profile of patients? Earlier on, if you were older, between 50 and 60 or even more, you were perhaps more vulnerable. Over here, even those between the ages of 40 and 50 are more vulnerable. This is what doctors are actually telling us. We spoke to doctors in Mumbai, in Bengaluru as well, and in Delhi. This is what their clinical evidence appears to show.